was thinking about the opportunity to introduce this program. It dawned on me that 60 years ago, a junior senator from the state of Massachusetts by the name of John F. Kennedy wrote a book. It was called Profiles in Courage. And it talked about 8 senators who basically helped America change, evolve, and improve. I titled this, Profiles in Partnership. You're going to be hearing today from some of the folks who have made this possible. I think the key to this building is that it is a healthy home, because the families and the clients that will be entering this building have the opportunity to improve their lives, to improve their health. I can't think of a better thing for us to be working on.
When Mark Orndorff became the Health and Human Services Director, he and I sat down and really talked and discussed the needs and how we might go about accomplishing being able to finance something like this. And I'll tell you that there had been discussion about the need for a facility like this for years, but not really any way to get there. And we were able to do this without going out to the voters and asking to pass any new bonds or to take debt. We were able to do this within our current budget, both within Health and Human Services and the County General Fund. Something that's important, I think, to taxpayers is the way that we design the financing for this project allows the general fund to be paid back and generate a revenue over the years to come. Obviously, I've spoken about this multiple times in the past when I've done presentations about the county, but the truth is, when we started this project, we had no idea how much the need would increase over just this short period of time. We had roughly 19,000 people qualified for Oregon Health Plan in our county prior to Oregon's version of the Affordable Care Act or Coordinated Care. We now serve nearly 55,000 people in the county for public health, dental health, and mental health services. And the county serves about 11% of that population in mental health, so our caseload went from roughly 2,000 to close to 6,000 people within the last year and a half. And that's just one portion of the system. So when I talk about need, man, this has been a moving target in terms of trying to address the need.
So for some of the folks we serve, many of you probably haven't seen them. You've had the opportunity to not run into them, because many of them were the faceless, the nameless people in our community. But I'm proud that our community has stepped up to invest in this new care model to serve these folks and give them faces and give them a voice and give them services that they do deserve. This will be a system where providers will come together, where public and private partnerships will flourish, and where it will serve as a model not only for this region, but I have no doubt for the state and likely the nation. So then currently, Oregon has set forth its own very progressive agenda. Health transformation efforts leading the nation in terms of developing coordinated care organizations to increase both the effectiveness but also the quality and the access of care that those amongst us receive. In December of 2013, as Danny suggested, we had a year ago 35,000 folks on OHP. We now this month have just shy of 60,000 folks. About 35% of us are on the Oregon Health Plan. In this building, we will serve 750 folks a day come through our various doors. We have 6,000 mentally ill people that we care for. We have 1,200 clients with intellectual and developmental disabilities that we serve. We have over 10,000 women, infant, and children that come in to get vouchers and to get nutrition education to make sure that they grow and thrive as kids should appropriately do. We provide 8,000 immunizations annually. We have over 120 various funding streams that we have as a department. We have Medicaid, Medicare, commercial, and the indigent folks that don't have any source of payment that we serve. So as such, our funding and our programs ebb and flow based on that funding. So we designed this building to accommodate that. What serves now as a therapy room may 2 years from now serve as a primary care clinic examination room. We wanted to build this facility in such a manner that it afforded us that opportunity to be flexible to meet the needs of the community. So today you'll have the opportunity to wander around and meet staff and see rooms and workstations, intake areas. But this is not about bricks and mortar, and it's not about rooms, it's about people. It's about a fundamental approach that we are adopting here as a community. An approach to work in collaboration both internally and externally with community partners in the public and private collaboration. It's a common sense way. where no door is the wrong door, where clients in the system don't experience handoffs but handshakes. A system where services, despite their funding source and many, many hurdles to coordinate that have been set forth, that we come together to develop coordinated plans of care.
We as Health and Human Services provide mental health services, both treatment. We do crisis services would be downstairs. People coming in as a diversion to the ER is our intent for that space. So high cost service there, wanting to serve those folks on site and provide the care they need to create a plan for safety. We also provide therapy, group and individual. We have psychiatrists and psychiatric nurse practitioners on both the adult and children's side that provide care and medication management. La Clinica is embedded between our public health division and our mental health division, hoping to serve our significantly mentally ill population with primary care services that they may never access at another site, and do some appointment scheduling that's set up where they can do those things in one visit. Public health, we provide immunizations to travelers, elderly, kids. We also do communicable disease testing and consultation, and we do family planning on a walk-in basis. Coordinating a lab service with La Clinica, we do a lot of UA processing on the mental health side and public health side. We do blood processing, blood draw. We also have a WIC program. It's a nutrition program that serves babies 0 to 5, children 0 to 5. Nutrition program mixed in with a well baby check. We serve kids on the kids area in an integrated manner. We have our children's mental health therapy folks sitting with our developmental disability case management staff. We also have some interaction with our maternal child health nurses that do home visiting to medically fragile kids. Partners in our children's service area are on the developmental disability side. So we have Families for Community that offers a family network program where you're pairing families that have just learned of their child's disability with families that have already been in that position. They offer support and classes on how to work with the schools and those kinds of things. And then we have Living Opportunities Samita program, which is behavior specialists that work with families about behaviors related to disabilities. Upstairs, really a large portion of this side of the building is all about adult mental health therapy and adult developmental disability case management.
And for me, in 25 years of doing this, I've never had the privilege of working with a client that was so driven towards providing health care for those the marginalized people in our society who wouldn't otherwise have access to it. And I think that this facility, not just the design, but the programs that are offered here are going to be a model for other health departments nationwide. This building, I think, is also very family friendly, recognizing that a lot of single parents with children will be coming in here, and there's actually a children's area in the waiting areas of the building, so that while the parents are receiving health care, that they can bring the children here with them, and that removes a huge impediment to health care for a lot of people.
Our idea right out of the gate on this, from input we received from the consumers, is they don't care what division they work, that the worker works for. They don't care what agency they work for. All they know is that they need assistance, and they need that to be a more coordinated effort on the part of us as the do-gooders, as I call us. We did not just want to put people in their divisions and transplant them over here, but rather we went through a very thoughtful process of commingling staff from different agencies within our division, but also within the community, so that they will be side by side with one another and developing what I hope to be relationships that will then serve the clients well. But long term, our goal is for each of those pieces of what is a very fragmented system now, is that there is one coordinated plan of care on behalf of that family, that the family is a part of, that they're accountable as a piece of that coordinated care planning. So that's quite a philosophical change, not only for our workforce, but statewide, and I think we'll be a leader in that. And this facility, while bricks and mortar don't change systems, it's people that do. We have a team of very caring professionals that are committed to this new vision of providing care in a different manner.